Hello, Dr. Gallagher. I am a plastic and reconstructive surgeon based in Indiana, specializing in gender affirmation surgery. So in this video, I'm going to talk about a pretty common occurrence which can happen usually about a month or two after surgery it starts. And this would be a very typical call we get to the office, in that I was doing great with dilation, I had lots of depth, and now dilation is suddenly getting more difficult, or not even suddenly, gradually get more difficult, and it's painful, and I'm freaking out, and I'm going to lose depth, and what should I do? So usually with these patients, in the weeks and months after surgery, we tend to be seeing our vaginoplasty patients quite frequently. So the first thing we'll want to do is bring the patient in, talk about dilation schedule. Oftentimes it can be that the patient, for whatever reason, going back to work, maybe hasn't been able to keep up with dilation, and check their technique, make sure that the patient is doing it properly. And if they need a little bit of extra help, our pelvic floor physical therapists are really good at helping out with that. But something that I can help out with, certainly we do see this sometime, is granulation tissue. So what is granulation tissue? Granulation tissue basically is, my way of understanding it is when your body is healing something and it's been a little extra. So it just does a little bit more than it needs to, kind of overshoots the runway, and you don't need granulation tissue. And then the weird thing about it is, which I don't fully understand, but granulation tissue is painful. It hurts. Patients, even when they can't see it, they're aware of it. If it's just inside the vagina, for example, they're aware it's there, and it can be really annoying with dilation. What does it look like? It tends to be thick and pink and fleshy and bleeds easily. The good news is, however, it's easily dealt with oftentimes. We don't fully understand why patients get this, or why one girl would develop a lot and other girls get absolutely none whatsoever. But we do know how to treat it, and usually the most common way to treat it is to cauterize it in the office with little silver nitrate sticks we have. So it just cauterizes and get rid of it. If a patient has a lot of that granulation tissue, sometimes we may surgically remove it with a knife. However, as horrific as that sounds, you don't feel it. Granulation tissue is numb usually by definition. So this is just one of the reasons a patient may be losing depth after surgery. It's something to think about. Most surgeons, even if, let's say, you're out of state and you're not able to go back and see your surgeon who did your original surgery, most gynecologists or surgeons would be comfortable with helping you out with this granulation tissue. It may take a few sessions to get rid of the tissue itself, but that is one of the very common reasons we see girls beginning to have trouble with dilation, and particularly causing pain, usually from about 4 weeks after surgery onwards. I hope this is helpful.